Hi, I'm Dr. Tanya. Welcome to Mommy Calls, your go-to source for everything pediatrics. Today's topic is bringing your baby in for that first checkup. After you go home from the hospital, your pediatrician's going to want to check on your baby within a day or two of going home, and usually they'll let you know on the day that you leave the hospital. And the reason we like to see your baby back in the office so soon is just to make sure that everything's going okay. That he's not losing too much weight, that he's feeding okay, that he's pooping and peeing normally, and that he's starting to grow and develop appropriately. Call your pediatrician's office to schedule this visit as soon as you leave the hospital. Now, the first time you take your baby into your pediatrician's office, getting everything together in the car and out and about may take longer than expected. So don't forget to give yourself a little bit of extra time to pack up everything you need and get out the door. When you first get to your pediatrician's office, usually a nurse will first check your baby out. They might do some measurements like length, head circumference, and weight, and plot your baby on a growth chart. So that way, every time you come in, you can see that your baby's growing appropriately. Then your doctor will come in and check your baby out from head to toe to make sure the eyes are normal, the heart sounds good, there aren't any skin rashes or lesions. And this is also your chance to ask your pediatrician any questions. Try to keep a list at home because what you think of in the middle of the night, you may forget the next day when you're sleep deprived. So I like to keep a notepad by the bed, scribble down questions as they come up, and then bring them into the office so you can discuss them with your pediatrician. When you first get to your pediatrician's office, try to avoid other kids that might be sick because you have a newborn and their immune system isn't fully developed yet. Some pediatricians may have a separate waiting room for well babies, or in my office, we put the newborns directly into an exam room to keep them out of the waiting room where there could be other potentially sick children. At the end of your first visit, your pediatrician will let you know when you should bring your baby back to the office. Sometimes babies need to come in a few days later to make sure that they're feeding well and gaining weight well, and other babies are doing great and your pediatrician might say, come back in a week or two. But if you have any questions in the meantime, don't forget you can always schedule a separate visit at your pediatrician's office or call them on the phone to get your questions answered. With a newborn, never hesitate. If you have a question or if you think something is urgent, call your pediatrician right away. Even at night, that's what we're here for. I'm Dr. Tanya. See you next time on Mommy Calls.